Hello there. Today I would like to talk to you about ethical dilemmas in taking care of elderly patients in the critical care units. And one of the aspects of taking care of a patient that is in the critical care unit is when they decide to voluntarily stop eating and drinking. If the patient's aware that they're terminally ill, then they don't want to be a burden to their families anymore, and they just decide that they just want to take matters in their own hands. And if they stop eating and drinking, it'll terminate putting off the inevitable. The case study scenario that I would like to use concerns a 60-year-old university professor of music, and we'll call him Mr. Anthony. He's diagnosed with Parkinson's disease, and he has rapidly progressed in this disease and gotten worse. His family includes a wife of 40 years and two sons, one of whom is a lawyer and one of whom is on the board of directors of the hospital where he's in the critical care unit. He entered the long-term care facility when his wife of 40 years could not take care of him any longer at home. He became despondent over the rapid progression of the disease and did not want to burden his family anymore, so he just began to eat less and less. He was admitted to ICU for dehydration and hypokalemia, and he was transferred to a long-term care facility. His sons felt that his father wasn't receiving good care at the long-term care facility, and the wife continued to feel guiltier and guiltier about him even having to be there. Mr. Anthony decided that the physicians offered Mr. Anthony the possibility of having a PEG tube inserted for his feedings, but he decided that he didn't mind having the PEG, but he only wanted one Coke a day, and he didn't want anything else. The family tried to intervene and request that he have feedings, and so there was a team meeting decision to continue with the patient's wishes. And even though that wasn't what the family wanted, that was what Mr. Anthony wanted. And he was of sound mind and could make this decision for himself. And in fact, 2 weeks after he had the PEG insertion, he did pass away. There are two ethical theories involved here, and utilitarianism, which is a consequence-based theory, and it's the greatest good for the most people, and deontology, which is obligation-based theory, and it's where some actions other than consequences make it right or wrong. Mr. Anthony, his ethical dilemma involved principles of deontology, and there are four different aspects of that characteristics, and that's autonomy, beneficence, non-maleficence, and justice. Autonomy is self-directed freedom, especially moral independence. Beneficence is maximum benefit with the minimum risk, and non-maleficence is doing well and not inflicting harm. And justice is the right to be treated with respect, dignity, and equity. The ethical dilemma here involves some questions. Should Mr. Anthony have been allowed to voluntarily stop eating and drinking without the PEG insertion? And did the staff discuss all the possible solutions with Mr. Anthony, what solutions he had with him and his family? And the third one is, were his rights as a human compromised in any way? I would like to discuss this ethical dilemma in the context of the moral model decision. The M stands for massage the dilemma. Mr. Anthony knows that he's rapidly gotten worse and will never get better, and he doesn't want to burden his family anymore. Artificial nutrition and hydration can cause more problems than good at the end of life. The O stands for outline the options. Mr. Anthony is given a complete information concerning his choices, and he can either stop eating and drinking or not stop eating and drinking. And there's a multidisciplinary approach to deciding what his care should be. The ethics committee meeting might be involved since he is deciding to stop eating and drinking. And this outlining the options should also involve the family, and it should have family conferences involving the patient and not involving the patient. And of course, with everything else, there should be complete detailed documentation with of what activities and what decisions were made and all that. Resolving the dilemma is what the R stands for, and that is when the patient and the family get together and participate in the meetings, in their care plan meetings, and all the options are laid out there and explain the possible outcome of not eating and drinking. And the A stands for act by applying chosen options, conduct multidisciplinary and ethics committee and family meetings, and create a living will with his desires, and allow him to stop eating if that's what he wants. Looking back and evaluating is what the L stands for, and the members of the healthcare team would need to meet and decide if Mr. Anthony's option choices were supported, and if the staff needs to address any issues that hindered them during this process, and if autonomy, beneficence, non-maleficence, and justice were evident in Mr. Anthony's last days. Nursing care for chronically ill involves creating an ethical environment, and by doing this, there are three things involved. The nurse needs to increase her knowledge about ethics. She needs to be a patient advocate at all times, and she needs to know how to communicate effectively with the other healthcare team members and the family. All of this has changed so much over the last 20 years. It started out just where you just took care of people and they just, did whatever they wanted to do. But nowadays, things have gotten so medically, legally involved and rights-oriented that you have to do what is right for the patient, and each patient has the right to make their own decisions about death and end-of-life issues. Thank you.